All right, let's get started. We got a couple new people. We got Michelle. I'm sorry.
I'm Erin.
Erin.
Oh, by the way, this is the new.
We got James. I know James.
New arm attack.
What's that? Yeah, I think I remember.
Yeah.
I remember. But thanks for coming, guys. This is our second one here. So we're talking about the pelvis today, more specifically. Last time we talked more about the core and like the rib cage. So the person that asked for about the pelvic stuff is not here right now. Hopefully she's coming. If not, that's fine. So I kind of want to talk a little bit for those that are not familiar with me. My name is Kento. I'm a physical therapist. I treat out of right now in Kento in New York City as well, and I treat out of in a Pilates studio right now, right, literally across the street is Stop and Shop. I teach currently in Seton University for cadaver anatomy along with kinesiology. I've taught seminars kind of nationally about breathing and movement assessment for a little bit, kind of going the direction of not doing it at a certain point so I can stay with my family more. So anyway, that's a little bit about me. Do you guys have questions? So it's more of a Q&A discussion. I'll talk a little bit. I have a PowerPoint, but I don't know how to put it over there, so that's not a big deal.
Do you want to work on that in the meantime? I can set it up.
We'll do it for next time. It's not a big deal. It's not the best PowerPoint. It's just pictures. So if you guys have questions about the pelvis, so I have a mobile pelvis here, so you can explain things better. But does anyone have questions about the pelvis? So we're going to talk about more from last time when we talked about is a pelvic tilt. And we're going to talk about different types of pelvic tilt in a sense of maybe tilting through here or tilting through, well, this is open. There's just different types of pelvic tilt if you are willing to look at it that way. But other questions that you guys may have about pelvis? Or even this general region? Nothing?
Gina's out here.
Just talk about it? Fine. All right, so we're going to talk more like the intricacies of pelvic tilt more so today. So who has given a pelvic tilt exercise to a client? Right, who has given it and has hurt, or people that done it and didn't work well? Or did it work every time?
No.
Right, in my experience, it's not going to work every single time. It's going to have points where they have back pain, or other things could happen, right? So when you guys are looking at pelvis, when I say pelvic tilt, what is our understanding of it?
Neutral, posterior, anterior.
Say it again.
Posterior tilt.
Posterior tilt.
Anterior tilt.
Anterior tilt. And neutral, right? Perfect. And when we discussed it last time a little bit, but for those that weren't here, I'll discuss a little bit further. Would you believe that the pelvis has certain direction it can go, not just anterior tilt, posterior tilt? Would you believe that there's a possibility that it could close a little bit this way and open? It's not going to move this much. It never will, right? But forces and directions from physics standpoint, it can, right? So when we are looking at pelvic tilt, what I want for posterior pelvic tilt when I do that is I'm looking at not just this, but also a little bit of closing like this. Because the oblique muscles here, it's going to attach more towards here, right, along with the back over here. But if I use the oblique muscles, it will close in the front, right? But if I use kind of like my glutes to posterior pelvic tilt, it's going to open and posterior pelvic tilt, right? Some intricacies with that, right? So when you do the posterior pelvic tilt, what do you guys usually feel? So again, glutes,
Lower back tendons.
abs, low back, right? Abs. And when you think about posterior pelvic tilt, what part of the abs do you picture? Kind of lower right here, right? Right? So, of course that works as well. What I want for a patient at times, but many times for me, is I want them to feel the oblique system / the deep core system if you can feel it, but I would say oblique to make short, along with the muscles in the hips. So, when you look at a pelvis that closes this way, it's easy to think about here, right? Like up here. But if I think here, it's a little bit harder to picture. Can you see that? Right? Can kind of, when someone posterior pelvic tilts, activating the glutes is easy, right? Like squeeze the glute and you posterior pelvic tilt. You see that? Or for some people, it's going to be pelvic floor. They tighten, kegel, they get it. But if I look at, a good example is going to be the groin. especially the adductor magnus muscle. You guys know what the adductor magnus? Have you ever heard of the adductor magnus muscle?
Yes.
Right? The adductor magnus muscle attached to the adductor tubercle, which is right here, goes from the pubic all the way to the ischial tuberosity. So if I may put it this way, let's say the femur is stable and it contracts really, really well. What it will do is pull this pelvis this way. Can you guys see that? Right? From a force standpoint, it's not going to move like this, but this is what you feel. The adductor magnus will assist or work with the oblique system. Does that make sense?
Mm-hmm.
Right? That is crucial when it comes to good stabilization here. If the person can handle it up here. Does that make sense when I say that? Yeah?
Mm-hmm.
Right? Guess what other muscle could possibly do that? From the hips. James can't answer.
Is the kid in the front of the class always raising his hand?
What's that?
Is the kid in the front?
Dave's not talking on psoas. Oh, psoas could as a possibility for sure. I got the iliacus as a possibility, but we're gonna take that away because that'll be a little more like concept. Should be a little harder. What muscle attaches to the ischial tuberosity? You can take a guess. If for those that have some of that. Hamstrings.
I was gonna say,
Got a quiet group here
I don't
today.
want to be wrong. I'm so nervous.
So hamstring, because the hamstring attaches here in this way, right? So it kind of goes in this angle a little bit. So if I can also, if I use my hamstrings, I will be doing kind of like this, right? And posterior tilt as well, right? So a lot of times the way I would teach a person to posterior pelvic tilt, right? In the beginning, I'll teach posterior pelvic tilt, however the hell they can do it. I don't care how they do it, because they first need to know how to do it. So I'll just say posterior tilt and just flatten the back, put your hand under it, flatten the back, whatever it is. But as you get better at it, I want to be able to, if the person can handle it, how to load it in a three-dimensional fashion. And when you loaded it from a three-dimensional fashion, it feels very, very different proprioceptively. Right? Gerard, are you able, sorry, I'm sure you
I think I need all day because I'm my physical.
Oh, yeah. So like, you know how we've done some of the hamstring
I was
drills?
gonna say, it sounds a lot like that hamstring.
The hamstring drill. So can you just share a little bit if we're on the same page? Can you share a little bit?
You want me to do the drill?
No, just share the experience.
So for the single leg,
Yeah, the single deadlift.
so he asked me to do, I had a hamstring issue before a race, so he asked me to do a single leg reach or a single leg deadlift. And after I did it, when he sort of corrected it, it was drawing much more on the groin, the inner, like, so instead of just feeling my posterior chain, it was really getting in the lateral area, like really aggressively felt the groin and the adductors working, and it was like, it felt like I was squatting 500 pounds instead of like a single leg deadlift.
That's it. That's all I need. That's all I need.
his foot was pointed straight when you did that, or you
The
rotated
foot was
it?
pointed straight.
And that's because he was controlling his
But I had
pelvis
the
more?
hip.
Is that why?
He was.
I had the
Okay.
hip kind of the opposite, right? The opposite hip was kind of, you know, the hip, the leg I was on, where you're having me drive that hip slightly out, right?
Yep. Yep.
Which made a big, that's what really got to the groin. So instead of being very, even though the foot was straight, the hip was kind of driving out. It really got my groin.
Were you manually doing that, or was it more like a?
No, he was getting into the hip very well.
Okay.
Yeah.
I'll show an example of like what it will look like from
He's unenjoyable.
yeah, it's not, yeah.
That's a good.
That was live, you know that.
Yes.
That's almost like a compliment.
Yes. Gerard loves my exercises. So I'm gonna somewhat show an example of a single leg deadlift. Is more like glute quad-ish, right? You may feel the hamstrings, but you'll look at this way. And I'll show a single leg deadlift that is gonna be loading the hip more in the sense that it's much more efficient, at least from what I know, right? There's no right or wrong in my head, but that's what I think it is. Right, so if I do a single leg deadlift, a lot of people will kind of keep that back straight and go down, and this pelvis will kind of open as they go down. right? When it happens, the glute muscle and the quad muscle and hamstring muscles is going to be the one that you will feel often because it's contracted. Feel is a very subjective story, but those are the muscles that likely will be on, right? The difference what I did with Gerard is I made him shift his whole body over to the right, or all the way, and I make sure this pelvis is almost like if you've seen a Trendelenburg, I'm getting into the Trendelenburg, but not by this. That's a Trendelenburg in my eyes, it's not in control, but in a way you are sinking and getting into it. And then from there you go into a single leg deadlift. And what happens is you load all the three-dimensional muscles into the socket, much cleaner. If you ever seen an adductor muscle fiber, right? So if you take a look at the acetabulum here, this is the hip socket. Can you, if you see this, right? Can you see how it's going into kind of a 45-degree angle? Can you see that?
Yeah.
Right? The adductor muscle, along with the glute max especially, the adductor muscle from here goes into this 45-degree-ish angle. The hamstring goes into this 45-degree angle. The piriformis, all that, will go into like this angle more so. Not so much this as much. So if I push my femur in this angle, in this 45-degree angle, can you see how it loads into my hip socket well? But a lot of people with tight glutes, you see that all the time, or really tight backs with tight SI joint issues. In my experience, they would lean like this, or their hip is kind of like out this, like that. So if I push from here, see how it doesn't go into the hip socket very well? Right, it's inefficient from a physics perspective. These are the people, in a sense, they'll walk like this all day, right? Or they kind of walk, they kind of lean like this as they walk.
Your hips are full.
Yeah. Have you ever done like a really heavy deadlift one day? Like deadlift session, and you're like, oh crap. That was a rough deadlift day. Right? And that's what happens in a sense.
4 minutes for that.
Right? If you did deadlift a lot to the point that you don't have a recovery strategy, that may happen. You forget how to use the hamstring, groin, and the obliques. Because you feel those things. You feel the deep glutes, or the top, the glutes, quads, back. If you do a deadlift that was too much in a sense. Does that make sense? Does that relate at all?
Yes.
You can say no.
Yes, no.
Because I'm happy to
That's
change
how I
my
felt after that race, too. I was walking like that after that trail race.
Would you like to share that experience too?
But that's why, no, I'm just saying. That's how I was walking after we did that.
Oh, the big race you're talking about.
24-hour trail race.
Right.
I was walking just like you were walking.
Right. You can't shift into the hip when you're completely exhausted. But when you can shift right and left like that, I know, at least mechanically, you're shifting or loading the hip socket.
It's gait.
It's gait.
Proper gait.
Yeah, it's gait. And if you look into gait mechanics or even gait books out there, you are a little bit allowed to kind of, so let's say if I shift into the right hip, I'm allowed to drop a little bit, and then drop a little bit. Right? To me, and if you ever heard Trendelenburg, where they talk about people and they like stand on one leg and they're like this, right? If they drop so much they have no control to come back up, that's a bad sign. But it's not a bad sign for me when you can drop into here and then come out of it. That just means you're utilizing the muscle very well. Does that make sense?
Can you show on the skeleton what the pelvis does through gait?
Sure. Here, you know, you're just kind of like being a nice guy. All right. So, ideally, when I'm walking, if I put weight onto my right leg, this side of the pelvis, I'm going to do right leg. This side of the pelvis, I hope it can handle pressure. So it's going to be more that posterior pelvic tilt position. And then the other side is going to be like that. When I stand on my left leg, it's this. Right? It's literally, this is happening from a very small millimeters perspective, but that's the sensation we're going for. If I'm shifting over to my right hip, I'm making sure I can weight bear. Everything is there. The hip is loading very well. Posterior tilt, core is nice and compressed, whatever it is. This side's the one that's freer, so it allows me to swing.
So your hip is externally rotating a little?
In this one,
And that, yes.
position-wise it will.
Okay.
In position-wise it will, but you'll still feel like the groin and hamstring. So, yeah. Question on these so far? What did you get out of what I just talked about?
Biomechanics of like how walking, weight placement, how it opens up the hips, how it moves the hips.
Perfect.
What's a healthy way and what's not a healthy way.
Right. And I'm saying, just an FYI, a glute posterior pelvic tilt is not wrong.
Okay.
It's just that you want to make sure to be able to do both, in my eyes. Right? It's the same thing. If a person comes in and they can only do, I don't know, let's say they do a squat and they only feel quads all the time, right? And they don't feel any glutes. That probably is not a good thing eventually.
No.
That means that person cannot adapt any other way.
Yeah.
So if I give them a kettlebell clean, a rack on right side or kettlebell clean on the left side, they don't know how to adapt. They can only use one thing to do things. And what I want for people is adaptability and resilience. And the ability to do that will be very, very helpful. But if they're doing one thing all the time, or they're doing the same thing over and over and over again, that eventually will lead to the lack of adaptability, which leads to issues. You're doing the same thing over and over. If I extend my back all day, and I can't do this at all, or I can't stand on my right side or left side, that eventually creates issues. Does that make sense?
Yeah.
Cookie, good to see you. What else? What's the muscle that we discussed about that could help with posterior pelvic tilt?
Doctor.
Adductor, what else?
So
So it's a possibility. Yeah.
Hamstring. Hamstring
Obliques.
oblique.
hamstring.
Hamstrings. Yeah. Has anyone tried
So proper posterior tilt is going to be glute, hamstring,
No glute.
adductor, and obliques.
Yep.
All of it working.
Glute
Yeah.
as well, or
Glute as well from a hip extension standpoint. I probably want externally rotating hip though. Because if I do too far into it, right? So let's say my glute attaches to the IT band, right? And a little bit on the gluteal tuberosity on the femur,
Mhm.
right? So what it does is if let's say my center's stable, what it does, it pulls like that.
that dramatically?
Well, no,
Is
it's
that?
not gonna be that dramatic, but like that's the direction.
I was saying, those are gonna fall off.
No, that's when you go call 911.
Yeah.
But it's the direction it's gonna go.
So that's not what you want.
No, not in
Right.
the beginning.
Right.
Not in the beginning.
So would a cue to like, if you're doing like a split squat
Sure.
or you're hip shifting,
Yep.
would a good cue would it be to press on the insides of your foot? Like almost like you're like focusing here so you feel adductor?
Oh, the press inside of
Yeah.
the foot.
Yeah.
Sometimes, but
Okay.
not. I think it's a great call.
Uh-huh.
From this current conversation, it could be once in a while, but not all the time.
Okay.
Yeah. I won't. I sometimes cue it that way.
Okay.
Not as a majority.
Okay.
If that helps at all.
Okay.
Yes.
Just from a physical therapy perspective, like I'll have patients a lot of times activate their adductors by squeezing a ball or a Pilates ring or something like that if I want to engage all those core muscles.
Mm-hmm.
So yes,
Yeah, absolutely.
that we could just squeeze something here.
Yeah,
to
squeeze
ask for
something as well.
activation. And
Would you activate? Let's say you want trying to activate adductors or whatever it is. Would you activate with a ball or a ring, whatever it might be, and then move on to the next exercise so the muscles are
No,
firing?
a lot of
or
times I'll have them hold it there for a lot of the exercises, especially initially when I'm trying to get their core activated. I'll have them squeezing either in or a band outward depending on what I want to activate.
Kento,
Yes.
question. So I know we've discussed this before, and especially as trainers, we tend to focus more on performance than function. So there's always that debate, performance versus function. And I know, you said you want to be able to use the glutes as well as the hamstrings. Because I know typically in performance, from a performance standpoint, we're going to gravitate towards using the glute. Can you expand on, those two thoughts, or when it's too much, when using too much glutes can become a problem?
Right. Let's see.
So like a hip thrust or like a squat, for example.
Right. Let's see. So to make sure I interpret that well, so you're saying, when is it we still want to activate glutes, right? But when is it too much?
Right, because, you know, a lot of times, like, I would say, like, most trainers, they'll cue their client, squeeze the hell out of their glutes.
Oh, I see.
To get posterior pelvic.
Is that a common one?
Yeah.
And
Or
then
is that a question you guys may have?
Posterior pelvis a lot.
for both, like when you're trying to extend through the hips, right? Kettlebell swing, like deadlifting, squatting, when you're extending through the hips, we're learning, or we've been taught that like we want to try to really squeeze the glutes out.
Right.
And the glutes.
Right.
In gym classes, they do that also.
Right.
Right. It's a very common cue.
Yeah.
It's a very common cue.
Huge kids to squat.
If I'm being honest, I won't cue that way.
The range after the
I won't cue that
I
way.
do that in high school. Went to Berkeley.
Gym classes, like at the gym. They did that, like,
Oh, yeah.
Just talking about real gym, not your school.
Not gym class.
I was thinking, I was like, you still do that?
Not
I'm
school.
very tired. I'm
Not
very
school.
tired.
So let's talk about the glute thing. Glute thing. So I'll first admit that I used to say a lot about squeeze the glutes at the top of a bridge or a deadlift or anything of that nature. I'll be first and foremost to make sure I admit that, because that is something I used to do a lot, because glute is still a very important muscle, right? The thing about that, as I'm learning it may change in a couple of years, who knows, as I learn, is if I squeeze the glutes that we talked about and I squeeze both sides, there's a good chance that I'm doing this again at the top of a deadlift or at the top of a head hip thrust. And what it may lose because of that is, imagine if I do this, what is likely going to get lost here?
But what if you're on a posterior pelvic tilt?
Posterior pelvic tilt, I hope I'm here.
Right. So then you don't lose that if you squeeze.
Oh, if I squeeze the glute, right?
Yeah.
If I squeeze the glute and posterior pelvic tilt, I'm doing this. I'm opening the front while posterior pelvic tilting. So what may happen from an anatomical standpoint is this part went up, but none of these closed along with it. So this what may happen, right, as a possibility, is the person's six-pack muscle overdrove along with the glute, and the obliques started to get lost. So just an anatomical standpoint, just to review a little bit, is the obliques, let's say external oblique, internal oblique, and transverse starts on the rib cage, attaches to the pubic area, right, ilioinguinal ligament and all that, and also goes all the way to the back, all the way up to here, the internal oblique. What that means is this whole thing, the oblique, is going to be a strong, strong core set. External oblique, internal oblique, transverse is a strong core set to stabilize the whole trunk. So if I have to choose from just from a real estate standpoint, I'm making sure I'm using these to help myself. If that helps. Glute, in a sense, will come. So, like, if we think about our muscles, it's kind of an elastic nature tissue. So if you actually stretch it well, or eccentrically load it, it will contract. So if I'm going into a position where I am getting into my hamstring and groin like this, you can probably sense that this is gonna stretch. That makes sense? So as I come up from it, the glute's gonna get engaged for the most part anyway. Does that make sense? Does that help, Aaron?
Yeah.
By any chance? And I hope you know I'm not trying to bastardize like a glute squeeze posterior pelvic tilt. There's a time and place for that. It's just that because of, we all have trends in our industries, right? What I've noticed with who knows like strong first kettlebells, Russian kettlebells. So I've RKC and SFG, although I don't certify anymore. So it's been right. So I just did it once. But the common thing is squeeze those glutes, like out, along with pack that lat.
Yeah.
Those are all helpful to a certain extent.
Right.
At a certain point, it's like I'm hurting my back now. I'm hurting my shoulder. My neck hurts now. Because if I keep packing, what they're talking about packing the shoulder, and I'm kind of sorry, I'm trying to veer in a little bit. They're talking about rotator cuff, but it's not about lat. Everyone does lat. And it's not necessarily a great shoulder muscle to stabilize. Sorry, I need to try to do that. Any other questions? So did I
Yeah,
anything
Yeah.
on that? Did I answer any of that questions?
Yes.
Yes. Okay.
Question.
Yes.
So, are you saying that you should cue the person who's doing the exercise to more draw in those abdominals, and so they feel the front of the pelvis is coming more forward?
Like coming around?
So just that's the cueing that you're saying to give if someone's going to do a squat.
I don't cue it in that sense.
So how do you cue it?
Oh yeah, no problem. So I don't really cue those in that direction because I know I've learned from certain like physical therapy courses that like you can cue it kind of closing in as a possibility, but I don't cue it that way
How do you
anymore right now. I cue it through breath
Okay.
and making sure the hamstrings and glutes are on, if that makes any sense. So I will tilt, breathe out, so everything is
So on
closing.
the exhale to engage those muscles.
Yep.
Okay.
And then while those are engaged, I inhale.
But while they're engaged.
While they're engaged. So I'm creating abdominal, what we call it opposing. So it's not like a breath where I'm just letting go of my abs. I'm just making sure these are there. So the ribs are staying down per se, and that allows my rib cage to laterally expand. So it gives me more of a 360 stability. When I do so that way, my back also expands and everything, so it allows me to get a more of a 360 kind of stability here.
So you're just keeping the contraction through those abs, and you're inhaling and exhaling, so it has your stability. point.
Exactly. Exactly. I will sometimes use that cue to close it at times, but I don't use it nearly as much as I used to. If that answers the question.
Why?
What's that?
Why?
I think it's because of the more I looked at gait, I want to make sure I get the power from here first, because the obliques and everything, my understanding of it is more of a rib mover more than a pelvis mover.
Internal and external obliques are more of a remover than a pelvis mover.
Because if you do, most muscles will have multiple functions, right? So if I have, it's a good sense. I don't know. Let's say use bicep for example, right? If this bicep have to constantly do this and this, because the bicep can do shoulder flexion and this, and actually supination too. If I have to constantly do this, this, and this bicep is weak as hell. Or it's compensated for everything else that's not there. But if my shoulder blade is nice and stable, because of my serratus muscle, my bicep can do a lot more work because I have more room to contract to bend the elbow. So that's what I mean by the obliques. If I have to use this oblique to really pelvis tuck and then try to breathe out with this, there's not a lot of leverage that I can use, if that helps.
During the last workshop, when we talked about lower back pain and addressing it, I think we talked about that as using it as a cue, like for a barbell squat or whatever it might be, and how we kind of cue that way before we start really loading weight and that sort of thing. How would that carry over? Like if you're, that's how you're cueing for a squat per se, but you're not cueing on the pelvis. Like how do you differentiate between the two?
Say that again. I'm not sure if I understood it.
We're cueing off a back squat, and last time we talked about to remove lower back pain, kind of cueing the rib cage with the obliques.
Yes.
Cueing the back squat.
Yeah.
But now we're talking pelvic tilt. If someone's having a pelvic tilt while they're squatting as well, we're not cueing with the obliques anymore. How are we going to cue?
Right. I'm still getting the obliques. The difference, what I'm talking about is I don't want the obliques to do the pelvic tilting as much. I want to make sure that the ribs are moving because of that. The pelvic tilt for me is going to come from the hamstring and groin, from what I'm looking for. Because if I have a pelvis from the ground standpoint, if I have a pelvis that's nice and stable here, through these guys, the obliques, all it has to do is say, okay, this is stable, I have a house, I have a foundation, I just need to pull these suckers down. So in the brain, in a sense, it's simpler. So all the things that's, like in a sense, the hamstrings and groins or whatever is doing its job to allow the obliques to do its job or what it's good at doing. Like to me, a lot of people's back is really, really tight or working in a different sense. It's because the back muscles is not only is it trying to extend the spine, but it's also trying to anterior tilt the spine. Anterior tilt this. What is this thing? Pelvis. At the same time. At the same time, it's doing two things at once. It doesn't need to, right? But what if I have a thing that is stabilizing really well? Then the back muscles can just work as a spine extender. Right? In a sense, I'm trying to give it a better role. Yes.
So sometimes
I noticed a lot of like people that I see, whether we're at a powerlifting competition or even some like little classmates of mine when I was like at an institute where we worked on a lot of movements. When they were doing squats or deadlifts, they'd try to hyperextend as they came up, and I noticed that would take like that would kind of put a little bit more pressure on the lower back and glutes. And I noticed that when I started like focusing on just like making my body straight and like maybe cueing them on that, they were able to feel their core activate, taking weight off their back, and they did definitely feel it more in their hamstrings. But the thing is like, I don't know if they'd be able to focus on their breathing as much. Like I feel
Not
like
during like a, you know, if I'm not going to do that to anyone. Well, in a sense, let's say they're deadlifting or let's say they're squatting 450 pounds, right?
Yeah.
And they never learned the stuff that I talk about. There's no way I'm going to teach them at that moment.
Yeah, no, I'm saying like,
Oh,
you're saying eventually you could work on the breathing with that, but like,
Oh, for sure.
I noticed like a lot of people have, like a few people that I was working with, I was working with or learning with. Like there's two people in that class and one person that I like one client that I had, and half of them were always taught, you know, they come up and they like shoot their hips there a little bit, and I feel like they definitely activate their core and their hamstrings more by making sure that they're just keeping their body straight, coming right up, you know, but not coming all the way, but they're coming through, just right before you come even, and then coming back down. But then I was worried about like when they're focusing on their core there, like to catch the weight, focusing on the breathing. Like you're saying, obviously it'll just take tons of practice. Then again, breathing in general.
Yeah, exactly. So to make sure I understood what you're saying, when you actually allow them to be a little more straighter, they got more core and hamstring, right? And the question you have is, how will the breathing almost like transfer into those activities, in a sense, right? And it won't be that quick. For me, I'm just teaching them how to breathe in general, and then add weight as we go.
Yeah.
But once you start getting it, you can really do a lot of weight with it, and you don't feel the back as much. You feel the back working, but you won't feel the stiffness or pain that you may feel often. If that helps. Good. Other questions so far? Am I answering some questions that you have, or you may have on the pelvis, or have more questions because of it, of what I said as a possibility? Cookie? You like shy today because of
Nah, I'm cool.
Ernest?
Yeah. So, like, I have a very strong core, right?
I agree with you.
Oh, for sure.
Let me stop you here.
See to do like deadlifts.
Right.
I can squat half an pound.
You can squat well, yeah.
Yeah. So like, what caused that? Like,
You say this is for girls.
It's the same
Remember?
for men.
I can squat heavy, but I can't seem to do deadlift. My back is always heavy.
Yeah, for sure.
What caused that? Why is that?
So, right. So, it could be a lot of things, but the possibility I'm thinking is your quads are huge in my eyes, when I'm seeing it, right? So, when you're doing a squat, the quads aren't going to be able to help you more, right? When you're doing a deadlift, your posterior chain has to work harder, right? So, my guess for you is the hamstrings has difficulty activating during the deadlift, but your back is there, right? So, in the squat, like quads and everything are there to help you out a little bit more, so it dissipates the forces a little bit more than the deadlift for you. But deadlift, I think you just can't hide from it. So your back is the one that has to work right now, and not enough distortion here. Does that help a little bit?
Yeah.
Right, that's likely the case. So if it is the case, like getting these turned on more often, or to be able to control the pelvic tilt from it, is likely going to be helpful for you. So it disperses the forces. And from a very generalistic standpoint, I'm talking about. Does that help?
Yeah.
At least from like a literally vector standpoint. Yeah, more? Okay, good. Zach.
Because of the nature of my industry, I'm usually always sitting in more like a C formation.
Mm-hmm.
So I'm always like this, mostly like this at a 45-degree angle.
In what industry?
Well, I'm
BJJ.
yeah, as a competitor, active competitor. He remembers. He remembers everything. It's great. but me and him we're always in these tight stances, and we usually like to counteract those with deadlifting, like back squatting, front squatting, things like that.
For sure.
But like when somebody's starting to express pain, especially in the lower section near like borderlining my glutes, wrapping around, is there like some sort of like cues I better give myself either when I'm front squatting or back squatting to specifically try and help correct that C formation?
Very specific towards you.
People in general that might be sitting a lot more of that like this.
People in general named Zach.
Yeah. I'm not the only one with this issue, but like.
True, it wasn't nowhere. It was very. I got you. It
See,
worked.
he gets me, George.
Yeah, of course, we're gonna be hard on you for sure.
I'm the youngest. It's fun.
Sorry, I just
No,
I
I get it.
stimulated that.
No, that's okay.
A possibility. That's a possibility. So, if you're kind of in that C curvature, right, that
Yeah.
hurts it right now, right? So let's assume that, in my assumption right now, from what I remember with you here, if you don't mind me saying,
Yeah,
this,
go ahead.
is you had difficulty getting those ribs down.
Yes.
Remember that?
Yes.
So guess what you would use to get this? Which muscle do you think you tend to use?
Well, I would.
Which ab?
Low ab.
Rectus.
Lower ab. Like, yeah, rectus abdominis. The six-pack ab.
Yes.
Okay. So when you're using that, do you think you're getting a good, nice pelvis stability?
Stability?
Correct.
Absolutely not. I don't
No.
feel like they're connected at all.
Correct. Correct. In your case, what I believe is this and this feels
No.
disconnected.
They are disconnected.
Right. From a sensation standpoint.
Yes.
Right. And I'm trying not to diagnose. I'm just
Yeah.
asking a question at the same time. So, if that's the case, guess what your pelvis is doing when you're doing that C curvature?
They're always.
It's this and this.
Really?
That's a likelihood.
Okay.
You're not doing this and this. And notice what happens to that side joint in the back. If I do this and this.
Forces this weird curvature in the spine.
Oh, that in a sense, but also see what happens in this part of the bone.
Yep. Stabs into it.
You're compressing the back part of the side joint in a sense,
Okay.
right? But if I'm doing this, it could open.
I figured because I'm usually always standing like this and my knees are pointing forward or my feet are pointing forward. So like I figured because like my knees tend to collapse inside.
Mm-hmm.
So like I would think that it would open it up the hip joint, but apparently some situations I'll probably keep them open and overextended like that.
These are quick questions. I like these questions, but are you guys getting something out of it? Yeah? Are you guys getting some kind of information out of this? Okay. Take a look, okay? Let's say your femur and pelvis is kind of glued together right now,
Okay.
right? And when right now my guess is you can't actually control the pelvis well, right? And that just me, let's say you don't.
Okay.
Let's say you do and you don't, whatever, but let's say the person doesn't.
Okay.
And imagine this femur is kind of stuck here. See what happens to this femur if I just do this.
Collapse inward.
Exactly. So when you collapsed inward without a good oblique or whatever, guess what you did to the knee?
Stabbed into it.
You didn't do this.
No.
You assumed you did this.
Yeah.
You did this. Does that make sense?
Yeah, that makes sense.
There's a difference between when I do this, where I pulled it and this pelvis went down.
Yeah.
That is taking that tension,
Yeah.
right? There's a difference when I'm doing here, where I'm getting into the groin as I
Mm-hmm.
like this. This is closing like this. This pelvis,
Mm-hmm.
right?
Yeah.
That's when you're doing it, when you get that stability in the hip socket.
Okay. So you think it's like more of an obligation to me to try and get a better connection, like more these two sides of me speaking with each other more than just trying to treat them separately.
Say that again.
There's like what you're saying is like there's separation between the way I treat my pelvis and the way I treat my back. Like they're not exactly speaking.
Yes.
With each
I don't
other?
think they're
That's what-
speaking. Yeah.
no.
I would say even more specifically, I would say the obliques are not working well.
Okay.
To be very simple.
Yeah, okay. Okay.
Yeah.
How can you fix that though? Like, how can you fix it? Oh my God.
So what?
How can you fix
How can I fix it?
Ernest wants to help me.
I have to see him in assessment further.
Oh, okay.
Oh.
Yeah. The reason I say, because what I'm talking about more is what is ideal, right?
Yeah.
What I hope to achieve for the person.
Okay.
The reason why I quickly pointed that out, I don't mean to be as smart as I was, but I don't mean to be, is how Zach processes that information, how I give it to him, it's going to be very different from how you might do it. So I try not to just, there's a general term, where a general way to do it where I say, about 90% of the people I work with, this cue worked. But 10% might not.
Yeah.
So that's what I'm saying. And how I achieve that for Zach is going to be very different from how you achieve it, or Gerard achieved it, or James achieved it. So that's why I just, but that's the ideal what I want to do with him. When I say the pelvic tilt this way and the rib going down that way. Does that help?
Yeah, no, that helped a lot. Thank you. That
Right.
helped clear up a lot of gray, dark areas.
So, who wants to try a pelvic tilt with the hamstring going? Well,
Ernest?
Alphonse, I was going to ask.
Yeah. So could
I
you-
actually have this issue.
Right.
It's like when you started today, I'm like, oh, you're talking about me.
Well, we were talking about that.
Thought we were talking about Ernest.
So, Alphonse, is it okay?
Yeah.
And do you mind kind of sharing a little bit, if you don't mind?
Yeah.
Just a little bit. Well,
I mean,
I'll guide it so it's not going to take.
He's ready to have some cookies already.
All right.
No one knows, James. James, is your first day here? Come on.
So when we talk about the pelvis, or commonly when we talk about pelvis tilt, we will have a person tuck the pelvis and make sure the back is flat on the floor. The way I'm going to talk about today is the hamstring groin, or really hamstring for today, to tuck that pelvis. It's a very different tuck, how people may feel, right? So Alphonse, if you don't mind lying on your back for me. So easiest thing to start is lying on your back first, and you progress that to many different ways. So, easiest way to do it is lift your legs up. Yep. Yep. Okay. So, if you guys can, I would love for you to try. This is really cool to do. Or no, I don't know if it's cool. It's very tedious actually. But if you get it, it's kind of cool, right? So when you see a person do a pelvic tilt, right? So Alphonse, don't worry about the things that we work on, right? Just kind of flatten your back for me. And can you notice how this bulges to get the pelvic tilt? And he gets a kind of like a pelvic tilt. But when he did that, relax, right? Assuming he didn't do well, he just did with this rectus thing, just pulled it like that. That's all he really did. But I want Alphonse to be a person that can use his obliques and make sure he can walk better. So when he does a deadlift, when he does single leg deadlifts, anything, it feels stronger and everything connects well. So what I'm going to create is a hamstring-oriented pelvic tilt in this case. So Alphonse is first and foremost is not going to get any abs. I don't want any abs. And I'm going to say, can you dig into your heels? And Alphonse, can you feel these hamstrings work a little bit?
Yeah.
Good.
Now, yes.
Yeah, now you're good, perfect. So with those hamstrings, I want him to peel the pelvis, like pelvis or sit bones, off the ground a little bit. So peel it, like rotate, without using any abs. And that's hard. You'd be surprised how hard that it actually is. Okay? Good? How's that? Good. Come on down. Come on down. And I'm going to see if there's changes that I can create, or at least you can see. Let's see first. Okay, good. So, can you see this? Right? Alphonse, do a regular pelvic tilt like we just did with the abs. So just flatten your back. Oh no, not without, no hamstring. Just what we did, the bad one, let's say. Don't do any of this. Just flatten your back. The abs. There you go. Okay. So if you do with that, nothing. It's very difficult. This rib doesn't go down. Other things don't work very well. So just dig your hamstrings. Good. Here. Okay. And just peel that tailbone up a little bit. Good. Without. Keep going. Let's go a little more. Keep rotating. Keep spinning. Keep spinning. Keep going. Keep spinning. And Alpha's been working hard with me and God. Keep going. Keep spinning. Keep going. And this is much harder than you think. It looks like nothing is happening, but this is much harder than you may think. There you go. That's better. Go ahead. Okay, Alphonse, give me one big breath. Exhale. So now the hamstring is, or the pelvis is stabilized with the hamstring. Now I can use his oblique system to just get the rib down. Good, just one more breath. Good job. Good, relax. Okay. Let's assume he did pretty well, right? Did I feel pretty good, hamstring? Right? So I think he did quite well, so that will help the rib cage improve, which allows that shoulder blade to move in understanding positions. So Naftali, did you see a little difference in the shoulder range?
Yeah.
It's gonna go back very quickly, by the way. But when he did that, he feels safer because he's using the muscles that we want to use to feel a little more stable, which allows the ribs to move, which changes how his shoulder blade sits on the rib cage. Right? Does that make sense? Have you ever tried this kind of hamstring tilt or pelvic tilt before? Michelle, I kind of know. James, I kind of know. Well, Drew, I kind of know. But have you ever tried it before? I would recommend trying. You guys want to take like a quick 3 minutes to try?
Sure.
And then finish off today? Here, if you kind of use these things, I'll come around. Try.
These boxes.
For those that have experience, just kind of help out other people if you want to try. That's good. That's good practice. How'd it feel?
I'm still trying to feel the feel,
Good.
to be honest.
So let me just understand this.
Please.
Even though the
Yeah.
using the breath, you get this really
It's like $20
Yep.
for a half hour, but we all did it, because we had to like,
Yeah, exactly. So like, the reason why you use the hamstring next here is it's more sagittal plane oriented muscles, and the rectus is kind of like, so it kind of takes care of the rectus. So the rectus up there will drive it, so then the least hamstring is fine. So when I did that, it allows the ribs to move, scapula's in a better position, which, for whatever reason, intervention. Yes, yes.
too much.
7.5 mile travel.
Then you go back.
Yeah.
So the first thing you try
I
and
understand. So,
you can take it further. Your left side or the right side, the rest of the one side.
yeah, it stands for
That'll come right
treating osteoarthritis right now in my practice. What I realized was I would sound I've never been that for older, but
It was good.
So my
I hadn't run for 7 weeks, so.
everything just stiffens up. So the overfire is I don't see that
I saw the sleeve. So being one of the guys, I was like, oh, it's going to go. Definitely helped.
So that's what I'm trying to achieve. The thing is, just if you but I just choose to go that direction. Just
That's the part of the time I give it.
Yes,
So when I just got
Carissa, no. I know of Carissa, but
then
somewhere I don't know.
start to, and
Yes.
it's not always going to
I
have
do.
a lot of shit.
I got a couple high school.
You may not know so that rotation
Because of the way I'm practicing, it's a lot more like
How's your back? Shit, that's why I had to ask.
Oh yeah? Yeah, after Sunday, yeah, all the pain came back, and I don't think I didn't stretch afterwards, and that's when it's like it's murdering me. And I think, like he was saying, my pelvis is stabbing into my lower back.
so
It's so tight. Yeah.
So,
Yeah.
yeah, well, I give people like free consultations just to see who I am and work with me. But a lot of people I have Not in the sense of that. It depends. Like in a sense where is what they want. So I think, and if they can kind of see through a little bit, then
every morning, really early. He never asked.
short range here is if they are willing to go a little bit of it.
I don't think the accurate is not smart at all.
So some of the chances
He's pretty like strong.
What do you have him doing?
something like
You know what I'm saying? I literally just got him like a week ago.
so
Oh, yeah?
it's almost like a test. But if I can go through that, I love Shirley Starman. I took some courses. Like, I'm actually on the Girdle. I guess I was a great cook. I was great. She was starting. I got to practice at home. My master's was there. Posture restoration is a big one for me right now. Institute. PRI.
University, by the way, I'm talking about.
The PRI is a big one for me too. A lot of I enjoy a lot of the brain aspect of things. So how people process things. I'm realizing more like everyone, and we have so many things out there, but we're not a great process. It's really not when choosing that. When I actually look at a lot of Mackenzie reports.
I used to make all my plays, but if it's
Right.
Body's used to it.
now I go.
Oh, that's great.
Really wants that.
And I think a lot of us will go into this technique is better. It doesn't go that direction anymore to me. Exactly. It's more like whatever I have on the early if it does, it like the chances are and you can feel like the technique it doesn't work, but at least it's so different. That's what they're person. Let me give you Oh, thank you. I'm currently on this. Yes. Yes. I know. I mean, you do probably you can work because I get a lot of people that don't want it. Yeah, that's right. I know people from
I think it's like true.
Great. That's even better. Thank you so much. He's awesome. Yeah. That's great. Oh yeah.
Probably around 5:44.
So the idea is, hamstrings should be working to stabilize. Release and other muscles can do their job.
Correct. You're trying to stabilize through the lower, like the leg, for the pelvis.
Sorry.
No, it's my fault.
So guys, just gonna wrap it up real quick with
Yes, it's so nice to meet you. Thank you so much. Yes, absolutely.
Can I come up with a couple questions?
Yeah, absolutely. Should we text with me? Good to see you again.
Yes. Yep.
Are there like specific
Sure. So like a single leg in the first part.
I know, right?
You can with him. Yeah, because then at least I know like the practice, like the neurological practice. So when I get there, it's like, oh, this is how you're doing it. Let's do it this way.
And so because our last thing.
Like really shift into it. Yep.
Yeah. Yeah. So you're basically doing that with this level of back, and then this is on your bench. So you feel this whole thing even.
I don't know if you know, like tech, those companies that are like a therapy.
So what?
It's like therapy. So they
So
started using it for.
we went to lectures of compressing for building muscle, but I heard that you do compression for like
And the battlegram.
the fighter,
We
which
do
is
like
great.
a battlegram.